Patients with atrial fibrillation have, on average, 5 times higher risks of strokes. Some patients, the risk may be even higher depending on other risk factors they can have. Why is it that atrial fibrillation increases your risk of stroke? In patients with atrial fibrillation, the left atrium is no longer contracting normally, but rather just quivering. And what that will do is in the left atrium appendage, which is a small pouch we have in the left atrium, blood can pull there, and because it's not contracting and ejecting that blood out of the appendage, blood that stays stagnant can form a clot. And if that clot dislodges and goes to your brain, you could have a stroke. So this is why atrial fibrillation increases your risk of having a stroke. And the increased risk, as I mentioned, is related to other risk factors we have. We look at what's called the CHADS-2 VASC score, which is a scoring system that takes into consideration whether you have congestive heart failure, hypertension, your age, diabetes, prior stroke, heart attacks, or peripheral vascular disease. And based on how many points we have, we can estimate your overall 1-year risk of stroke to decide what's the best way to prevent strokes. A lot of patients, we indicate oral anticoagulation, and patients that have a high risk of stroke but are unable to take oral anticoagulation long term, today we can consider what's called left atrial appendage closure.